Hi everyone, we're a group of students from Ontario Tech University, and in this presentation we'll be walking you through a health policy proposal we developed for HLSC 3631U. Some questions that you may have regarding our policy is what it's about and why it matters. This presentation will answer these questions by focusing on an issue that affects millions of Ontarians, but is often overlooked: the lack of OHIP coverage for routine eye care among adults aged 20 to 64. Much like how dental care is increasingly being recognized as a key part of overall health, vision care deserves the same recognition. Science and policy have evolved to understand that oral health impacts everything from heart disease to diabetes, yet eye health, which affects safety, independence, and quality of life, is still treated as optional. At a time when our healthcare system is under pressure and preventable conditions are rising, we believe it's time Ontario brought vision care into focus, literally and figuratively. Hear about the background, our proposal of policy options, and our evidence-based recommendation for a more equitable and cost-effective approach to eye care. Let's start with a quick overview of the problem and our proposed solution. In Ontario, routine eye care is not universally accessible. While children, seniors, and individuals with specific medical conditions are covered under OHIP, adults aged 20 to 64 are left out, unless they already have a diagnosed condition. This is a serious gap, especially when you consider that over 1.2 million Canadians live with vision impairment, and 3 out of 4 cases are preventable with early intervention. Without access to regular eye exams, many Ontarians don't receive care until their vision has already deteriorated. This leads to preventable blindness, higher emergency department usage, and avoidable strain on the healthcare system. Our policy brief proposes that OHIP be expanded to cover one comprehensive eye exam every 2 years for adults between the ages of 20 to 64 and include access to optical coherence tomography, a clinically proven diagnostic tool. We also recommend better reimbursement for optometrists, a regional pilot program, and a public awareness campaign to ensure that the policy is effective and accessible. By acting now, we can prevent avoidable vision loss, promote health equity, and reduce long-term costs, both to the system and to individuals. Why do we need to do this? Vision loss has both human and economic consequences, and both are growing. In 2019, Canada spent an estimated $32.9 billion on vision loss. Ontario alone accounted for $13 billion of that almost $33 billion. And yet we know that 3 out of 4 cases are preventable with proper screening and early intervention. Unfortunately, OHIP policy doesn't reflect that. Since changes in 2004, adults aged 20 to 64 have been excluded from routine eye care coverage, unless they already have a qualifying condition like diabetes or glaucoma. A new funding agreement introduced in 2023 kept this gap in place, continuing to treat eye care as peripheral instead of preventative. This gap hits hardest for low-income, uninsured, and rural Ontarians, those who are already more likely to avoid or delay care because of cost or access. Without regular access to screening tools like optical coherence tomography, many people wait until their symptoms become serious. By then, the damage may be permanent. The result of this path brings on preventable blindness, more emergency room visits, and rising strain on an already stretched healthcare system. So while this may seem like a niche policy issue, the downstream impact is anything but. It's a health equity issue, it's an economic issue, and it's one we can do something about. Ontarians in their prime working years remain left out of OHIP's routine eye care provisions, thus paying out of pocket, unless they live with a medical condition like diabetes, glaucoma, or retinal disease. This is a problem for anyone in a demographic of low income or rural areas in Ontario. In many cases, people don't even know whether they qualify, and since an initial assessment isn't covered, the only way to find out is to pay for one. It creates a self-reinforcing cycle. People skip care, early signs of disease are missed, and conditions worsen until vision loss becomes irreversible. This gap in coverage contradicts the principles of universal health care, and it shifts long-term costs to more expensive emergency or specialist services. The result isn't just unfair, it's inefficient. It leaves a huge portion of the population unprotected from preventable health outcomes, all because of how coverage is defined. So we're proposing three options, with a recommendation that we see as the best option. Option 1 is to maintain the status quo. This would require no additional public investment, but it means continuing to exclude a large portion of the population from routine eye care. The result would be more preventable vision loss, deepening health inequities, and rising long-term healthcare costs. Option 2 proposes a targeted expansion. This would provide coverage to select high-risk groups, like low-income Ontarians or those living in rural areas. While this approach could be more affordable up front, it introduces complex eligibility requirements and administrative burdens. In practice, many people in need would still fall through the cracks. Option 3, the one we recommend, is universal expansion. This would extend OHIP coverage to include a comprehensive eye exam every 2 years for adults currently left out of routine care. Importantly, it would also include access to proven diagnostic tools like optical coherence tomography, which helps catch conditions early. Universal access simplifies the system, supports early intervention, and promotes fairness by treating vision care as an essential, not optional, part of public health. While this option does involve upfront costs, the long-term savings from avoided complications and system strain make it the most responsible and equitable path forward. Ontario needs to treat vision care as an essential preventative healthcare measure. We're calling on the Ontario Ministry of Health to expand OHIP coverage to include biennial eye exams for all adults aged 20 to 64, a group that continues to fall through the cracks. Expanding OHIP is not just good policy, it's an investment in prevention, equity, and cost savings. It's also a step toward honoring one of Canada's core values, accessible and equitable universal healthcare for all. Eye care has been treated as an option in optimal health, but vision is essential to live, work, and participate in society. A clearer future starts with clear vision. Let's make eye care accessible for everyone, not just some.